This morning in our community spotlight, we have the Ventanilla De Salud or Health Window program. And this is being presented by Diana Gomez Romero. So Diana is the bilingual outreach coordinator with St. Luke's Community Health. And as part of her work, she coordinates the Health Window program. And this particular program that she's going to be speaking on is a partnership between St. Luke's and the Mexican consulate of Boise. And the purpose is to provide health promotion, education, and access to preventive health services and resources.
Thank you, everybody. So happy to be here. And I'm going to begin to share my PowerPoint presentation. Let me know if you can see it. So good morning, everybody. Like Mary mentioned, I'm the bilingual outreach coordinator at St. Luke's Community Health, Diana Gomez Romero, and I'm here to talk about and share a little bit about the Health Window program, a partnership that we have with the Mexican consulate here in Boise. So these are just a few pictures from past efforts. This has been a partnership of now more than 11 years. So we're very happy to continue to work with our partners, the Mexican consulate, very committed to the work. But just for a little bit of context, these are some images from previous years. Like Mary mentioned, we do focus on providing preventive health education and access to medical preventive services. So on the left, you will see FMRI is one of our collaborators that has supported the program for a long time. And then we've also done some outreach, faith-based outreach in the past and continue to do so. So in this image, this is actually the colon education opportunity that we actually had out in the community. And then we've also collaborated with physicians as well to go out to those community spaces to meet people where they're at. And then more recently, of course, COVID. So we've had COVID vaccination clinics on site. And then up here is my colleague, Ruby Garcia, who is the bilingual outreach coordinator and the liaison to the Health Window in Haley, which is an extension of the Health Window here in Boise. So we'll kind of mention that a little bit more in the coming slides. But just to provide you guys with a little bit of background about this program, this is a national program. So all of the Mexican consulates across the U.S. Partner with a health agency, whether it's a government agency, a local public health district, or perhaps a community clinic. And it is a binational effort. So the Mexican government created this program at all of their consulates so that they would be able to meet the needs of their migrant communities that live in the U.S. We just happen to be, St. Luke's happens to be the partner at the consulate that is located within the Boise location. And so just to give you a little bit of background, but it is a nationwide effort that is present in many other consulates. So our particular partnership with the Mexican consulate began, like I mentioned, over 11 years ago. And so here you'll see that was actually the opening ceremony where St. Luke's leadership and then also representatives from the Mexican government came to Boise to inaugurate the Health Window in Boise, which is located within the Mexican consulate in downtown Boise. And then as part of that, St. Luke's Center for Community Health in Haley is another extension of the Health Window. So the work that they already do in that community also meets the mission of improving the lives of community members, improving access, removing barriers. So they also were designated as a Health Window. This is just an image of previous efforts as well. So like I mentioned, we do offer preventive health screenings on site because we're able to really meet people where they're at. They're coming into the consulate from all over Idaho. They happen to be there for about an hour, let's say perhaps to renew their passport. And so it's a great opportunity to really engage with them and answer any questions, provide them with resources when it comes to health. This is a current consul Ricardo, and Jeff Selig, who is our VP of Public Relations here at St. Luke. So just a little bit of background, but in terms of the Health Window and kind of how that aligns with our mission at St. Luke's, of course, our mission is to improve the health of the communities we serve. And so we do align within our footprint and that of the consulate, but just to let you know, the consulate does not just serve Idaho. They actually serve parts of Montana, Oregon, as well as Nevada. So we do see community members the majority of community members from all over rural Idaho, but also we do serve community members from outside of the state as well because of the jurisdiction of the consulate that covers just actually more than Idaho. And so one of our priorities with this program is to really work with the consulate to meet the needs of our community, and then also work with community partners that also serve the Latino and Hispanic community, Spanish-speaking communities. And so that way we're really able to make sure that our efforts are informed and evidence-based. But most importantly, the one-on-one interactions that we have with our communities at the consulate also inform us in regards to what are truly their needs, what would they like to see more of. And then, of course, opportunities with the health window, we're always looking to partner with more organizations that whose mission aligns with that of the health window and that of our collaboration with the Mexican consulate to really maximize efforts and really make sure that we can provide a holistic approach to preventive health education and also access to services. And so to give you an idea of what the health window looks like, it is actually within the Mexican consulate, and it's towards the back area. We have normally bilingual information on all sorts of health-related topics, access to resources. And then when we do have on-site screenings or preventive health opportunities, we normally have it in the back of the room. We've also had collaborators, like for example, the Family Caregiver Navigator, come out and set up a table, provide information for community members. And so, like I was mentioning, people are coming in for different reasons. They might be there to renew their passport, and so they are waiting already. And so it really is a great way to meet them where they're at. And then in regards to trust, a lot of the community members are Spanish speaking. They come from rural Idaho. They may not have access to, let's say, a medical home. And so we're really able to serve as a hub, an information hub, and really connect them with the appropriate resource. And so that's just I guess a visual of what it actually looks like. And then this is Ruby Garcia. She is our collaborator at Center for Community Health. She is our liaison for the Health Window program up there, and they do a lot of work with the Latino and Hispanic community up there. So they are also a very fundamental part of the program and our ability to serve communities throughout Idaho. And just to give you a snapshot of some of the efforts that have gone on in the last 2 years during the COVID pandemic, as you can imagine, normally we would be out in the community, providing information services, but because of COVID, we did have to pivot, like many organizations, to be able to provide information and education in a safe manner. And so we did a lot of virtual education because of this. We have the Facebook page for the Health Window, or the Ventanilla De Salud program, where we were able to constantly share information, resources as they related to COVID. As you can imagine, with the rollout of vaccines and the different guidance, there wasn't a ton of Spanish language information. So we really tried to make sure that we were sharing those resources so that the community had somewhere to turn to and a trusted resource so that they could get their information. And then, of course, we also opened up our phone line so that any community member could call with any concern, question, and that way we could also work around not being there in person and really still meeting their need and helping our communities. We've also done some faith-based outreach, which I will talk about here in a little bit, with some of the Catholic churches to provide health window bags with information that rotates from a month-to-month basis, depending on the health observance that we are focusing on that month. But we've done a lot of COVID because of all of the changes and the constant updates that have been going on in the last 2 years. And then we did work with our collaborators at Center for Community Health to leverage an existing mental health resource guide, bilingual resource guide that they created for their region. And then we tailored that one to Treasure Valley, which is now available both in Spanish and English, in order to provide more access to mental health resources. And then we have done selective health screenings, COVID vaccines, of course, flu vaccines, and some biometric screenings on site earlier this year when COVID had kind of gone down a little, and then some mobile mammogram bus opportunities that we were able to coordinate for the women that were coming to the consulate, as well as select events and community partnerships at the consulate. So just to give you a little bit of a snapshot of some of the success stories we've had in last year, we were able to establish care for uninsured community members, both on site and then also via the Health Window phone line. We also were able to do faith-based outreach. Like I mentioned, we went to Catholic church here in the area where we were able to bring some health window bags with COVID information, resources, and numbers, and we were able to help some community members locate a place where they could get their COVID-19 vaccine, provide them education over the phone. And then for that specific person, we were also able to provide them with access so that they could establish a medical home. And because of that, they were able to get both their COVID vaccine, but also their mammogram screening. So it led to more preventive health services that they didn't have access to beforehand. And then in terms of the COVID vaccination and flu vaccinations, we were able to help and facilitate vaccinating 736 people over last year on site, 39 preventive screenings, which included blood glucose, cholesterol, as well as mammograms, and then just continued partnership with all of our community partners that really work with us to be able to bring these services to our community. So we've been able and fortunate to work with the public health districts, community clinics, organizations such as Boise State, ISU, to really be able to work together and bring these services to our community. And then distributing masks, of course, and as well as some virtual education. So we did collaborate with the Mexican consulate on their Facebook page to be able to do Spanish language health talks in different topics. We were able to get some of our St. Luke's physicians who are bilingual to provide information and guidance on COVID-19 vaccines and prevention, as well as other topics such as women's health, and then collaborated with other partners to bring education on diabetes, even family caregiver navigator, Idaho Alzheimer's, to provide education in Spanish. So we're really happy, and we really hope we can continue with these efforts. And these are just some pictures from some of these events we had earlier in the year. And then in terms of the mental health resource guide, like I mentioned, we did create and tailor a bilingual mental health resource guide for the Treasure Valley. We did leverage it from the work of our partners and collaborators at Center for Community Health. And both guides are available online for free download, both in Spanish and English. So I can drop a link in the chat for all of you to check it out if you haven't already done so. But in terms of the Treasure Valley guide, we're still distributing the physical copies of it. So if you know of anyone that could benefit from having this guide, please reach out and I'd be happy to send you some. The great thing about these guides is that they are actually bilingual. So if you turn them around, you have the English side, and then if you turn it around, it's in Spanish. So it's all in one. But the most important thing is that it really does increase access since it is bilingual. And then all of the resources that are in the booklets have been thoughtfully been selected so that community members that don't have health insurance or perhaps have a language barrier can still have access to these resources. So that's something that is, a collaborative project. And like I said, it was leveraged from our partners at Center for Community Health in Haley. And some of the plans that we have for the upcoming year, so continued COVID vaccine outreach and education, as well as continuing with the virtual health education series for the year. We have different topics that we focus on depending on the month. So for example, the month of January, we brought information about the HPV vaccine and cervical cancer prevention. And for the month of February, we will be focusing on American Heart Health Month. So we are just looking forward to continue those efforts, continuing to increase access, especially with Spanish language health education, and then always looking to partner with more organizations that can help us bring more services and information and awareness on resources for our community members. We also hope to provide more preventive health screenings on site, COVID permitting, and then the My National Health Month is an activity that happens every October, where it's basically a whole month of health related education, preventive health services. So we will have more information to come this year, but very excited for that. And just wanted to include some pictures of some of our efforts. So this is the informational table that we provide at St. Mark's Catholic Church every month. We bring updated information on COVID and the different health topic or observance topic that we're focusing on that month. This is Dr. Nikachea. He is our community health medical advisor, and he supports a lot of our efforts and is always there to provide information and support for our Spanish-speaking community members. So we're very grateful. And Consul Alejandro Martinez, who is a deputy consul from the consulate. Some of the Walgreens vaccination clinics we had earlier this year. Here's Yvette with the Family Caregiver Navigator Project that came earlier this year to provide information about the program to our community members, some of the health window vacs we created in the last year, and then the mammogram buzz that we had last October, and then more recently this week. So some of the health talks that I mentioned earlier are available through Facebook on our Facebook page. So they're always there. And we really just wanted to provide awareness about the different services, but also about medical homes. You know, a lot of the community members we see are uninsured and they come from rural Idaho. So we really want to make sure that we're able to provide a plethora of resources and in different topics because of this. So if you guys have any questions, here's my contact information, as well as my colleague, Ruby Garcia, who's the bilingual outreach coordinator at Center for Community Health for the Health Window in Haley. And please do check out our Facebook page, as well as our St. Luke site, which has more information about this collaboration.